If you've ever had an ear infection, then you know how uncomfortable they can be. Earaches are painful for adults and children alike, but are easy to treat, if you know what to do. Bacteria or viruses most commonly cause ear infections, acute otitis media. Ear infections often happen as a result of allergies, colds, or upper respiratory problems. There are 3 areas in the ear where ear infections can occur in adults and children. Outer ear infection, swimmer's ear, an outer ear infection, otitis externa, most commonly experienced is often known as swimmer's ear. This infection usually is due to bacterial infection of the skin tissue covering the ear canal. Excessive immersion in water, or injuring the ear canal by putting things in it, such as using cotton swabs in the canal to remove earwax, makes you more likely to develop an outer ear infection. Middle ear infections. A middle ear infection, otitis media, is an infection just behind the eardrum, tympanic membrane, with pus trapped in the adjacent hollow cavity, middle ear space, of the facial bone. Middle ear infections frequently are a complication of the common cold in children. Most middle ear infections are caused by viruses, and will resolve spontaneously. Bacterial infections cause some middle ear infections, which requires antibiotic treatment. Inner ear infections. Inner ear infections are very rare, and usually are caused by a virus. These infections are more accurately characterized as inflammation of the structures of the inner ear, labyrinthitis. Since these structures affect hearing and balance, inner ear infections cause symptoms such as ringing of the ears, tinnitus, or dizziness and balance disruption, vertigo. Usually, inner ear infections need medical treatment. There are several earache treatment methods that can help to reduce your symptoms, including the pain and swelling you're experiencing. So let's take a look at the best home remedies for ear infections and pain relief. Garlic. Garlic has potent antimicrobial and pain-relieving properties that make highly effective as a home remedy for ear infections. There are several different ways you can employ garlic as a natural earache remedy. Make your own garlic oil by cooking 2 cloves in 2 tablespoons of mustard oil until it becomes black in color. Strain the liquid, and when it is just hot enough for you to bear, put a few drops in the affected ear. Be sure to use a clean dropper for this method. You can also boil a few fresh cloves of garlic in water for about 5 minutes. Crush them and add a little real salt. Put this mixture into a clean cloth and place it against the ear that is hurting. In addition to the above remedies with garlic, you can also consume a few cloves of fresh garlic daily to help boost your immunity and speed up healing. Sleep positioning. Lying down flat can sometimes worsen the feeling of pressure and pain in the infected eardrum. To reduce the pooling of fluid in the eardrum, consider the best sleep position. For children who are old enough to have pillows in their sleep space, age 1 and older, an additional pillow under the head may help. Although young infants should always be put on their back to sleep, older children can be encouraged to sleep on the unaffected side. In addition, a cotton ball lightly coated with oil or herbal drops can be placed gently in the older child's ear at bedtime to loosen wax and alleviate pain. Juice of basil leaves. Another natural cure for ear pain is to crush few basil leaves and use the juice to treat the infected ear. Strain the juice before using. You can add coconut oil in the juice to make it more effective. Make sure you use it regularly under supervision. Basil has long been used in medicines in Ayurveda and has been touted as one of the best medicines for minor ear infections and pain. Olive oil. Although there is limited research evidence on the use of olive oil to ease ear pain, the American Academy of Pediatrics recommends olive oil as an effective home remedy for mild to moderate ear pain. However, it is always advised to discuss the use of olive oil in your ear to soothe an earache with your doctor first, especially if you are planning to use it for kids. How to use it? Warm a teaspoon of olive oil and allow it to cool. Pour 1 to 2 drops of the oil in the affected ear. Ensure to check the temperature of the oil before use, as using hot oil can burn the eardrum. Although olive oil is the most popular over-the-counter cerumen-lytic, several studies have found distilled water to be even more effective at breaking up wax. For pain relief, olive oil may be better. If wax is the problem, consider distilled water, and follow the same steps for warming and applying used with olive oil. Apple cider vinegar. Apple cider vinegar is touted as the go-to remedy, one that your grandmother may have relied upon. Despite its strong aroma and acidic taste, this vinegar made from fermented apples has a plethora of healing properties. One of these properties is its antibacterial and antifungal characteristics. Known for its ability to fight chronic yeast infections, apple cider vinegar can also tackle fungus that may cause ear infections. To use apple cider vinegar for ear infections, mix 1 part apple cider vinegar with 1 part water. Soak a cotton ball in the solution. Place the cotton ball in your affected ear, and let it sit for 5 minutes or so. Remove the cotton ball, and lay down on your opposite side so that any residual vinegar can drain from your ear. Dry your ear out. If you don't have apple cider vinegar, you can use white vinegar. If you know that the location of your infection is in the eustachian tubes, you can try gargling with apple cider vinegar as well. Massage. Gentle massage can help with ear pain that radiates from the jaw or teeth, or that causes a tension headache. People can massage the tender area, as well as any surrounding muscles. For example, if the area behind the ear hurts, try massaging the muscles of the jaw and neck. Massage may also help with the pain of an ear infection. Using a downward motion, apply pressure beginning just behind the ears, and down the neck. Continuing to apply pressure downward, work forward to the front of the ears. This type of massage may help drain excess fluid from the ears, and prevent the pain from getting worse. Salt compress. A warm compress may help relieve the pressure building up in the ear as well. Using a compress for 20-minute periods while resting can help reduce pain. This can be done along with other pain treatments, including over-the-counter medications. Most people have no trouble finding a little salt in their home. Heat up 1 cup of salt over low heat for just a few minutes. Place the warm salt in a clean and soft cloth. Secure the end of the cloth with a rubber band. When you can stand the temperature, lay down and place the cloth on the affected ear for about 10 minutes. Repeat this daily to help bring relief. The warm salt will help draw out the fluid from the ear and reduce pain and swelling. Neck exercises. Another great home remedy for an ear infection is doing neck exercises. Because some ear infections are exacerbated by pressure in the ear canal, relieving this is crucial to keeping symptoms at bay. And given the connection between neck, jaw, and ear muscles, you're almost sure to notice an improvement from the infection with some light workouts. Just remember not to strain too hard while rotating your neck. If you feel like you're overdoing it, take a break. Herbal extract ear drops. Drops containing Allium sativum, Verbascum thapsus, Calendula floris, Hypericum perforatum, lavender, and vitamin E and olive oil can help children suffering from a middle ear infection that requires active treatment, rather than simply waiting for the pain to diminish over time. One study found these drops to be just as effective as prescription drops. Hydrogen peroxide mixture. Spending time at the pool in the summer can help to cool you off, but too much time in the water can result in swimmer's ear. To get rid of water trapped in the ear, you can make hydrogen peroxide earache drops from a 1:1 ratio of peroxide to water, and use a dropper to put the liquid into your ear. Combining equal parts vinegar and rubbing alcohol can have the same effect. Both combinations help provide earache relief by drying out the ear and getting rid of excess moisture. Using a dropper, fill the ear canal with peroxide. Pull gently on the ear lobe to help the peroxide go all the way down into the ear. If an infection is truly present, there will be lots of white bubbly foam coming out of the ear. This is all normal. Retaining the peroxide in the ear for 5 to 15 minutes. Then turn over and allow the peroxide to flow out onto a towel. Colloidal silver. Colloidal silver is a natural microbial antibiotic made of minute silver particles suspended in water. Colloidal silver essentially cuts off the oxygen supply of infections, thereby making it very difficult for them to remain alive or spread. The process of treating an ear infection with colloidal silver is very similar to hydrogen peroxide. Rather than filling the ear canal with peroxide, however, you should only use 2 or 3 drops of colloidal silver in the infected ear. Using colloidal silver in both ears will help prevent the spread of the infection to the other ear, which often happens. Retain the colloidal silver in the ear as long as possible, but for at least 10 to 15 minutes, before allowing it to drain out. These drops should not be used in people who have ear tubes, permanent injuries to their eardrum, or certain ear surgeries. If the infection is not getting better or other symptoms develop, a person should stop using the drops and see their doctor. Ear drops should not be used in an ear that has any discharge coming from it unless prescribed by a doctor. Ear discharge, drainage, or blood is a sign of a bigger complication, such as a ruptured eardrum, which needs immediate medical attention. The ears are one of the most sensitive body parts, and their cleanliness should be one of our priorities. Our ear canals produce earwax, as a way to protect the ears from dust, foreign particles, and microorganisms, and themselves from irritations as a result of water. The excess earwax leaves the ear canal from the ear opening naturally, but sometimes, the excessive production of wax in the ear canals can block the ear, and even lead to hearing loss. A lot of times ear infections can resolve within 24 to 48 hours of symptoms showing up. If symptoms do not subside after the standard waiting period of 24 to 48 hours, the infection will need antibiotics to heal, depending on the type of infection. If it's the swimmer's ear, it would be an antibiotic drop and not by mouth. And if it's a middle ear infection, it's usually an oral antibiotic. If there are recurrent middle ear infections, then a referral to an ear, nose, throat doctor may be indicated, if that child needs ear tubes to be placed to try and break that cycle of ear infections. If you like our content, please consider to like and share, leave comments below and subscribe to stay updated with us. Thanks for watching. See you next time.